10 centimeter Barrett's esophagus with multifocal low-grade dysplasia at 4 levels and high-grade dysplasia at 36 centimeters from the incisors, confirmed by a second expert pathologist. Barrett esophagus was a Bragg classification of C11M12. There was 3 columns of esophageal varices and type 1 gastric varices. There was a flat lesion at 36 centimeters with irregular pit pattern on the varix. So we applied 5 bands on the varices and 4 bands on the Barrett's esophagus on the opposite walls. The plan today is to perform a multifocal balloon cryoablation for Barrett's esophagus.
Varix here on the right, that doesn't flatten, if you see that. On the left at around 11 o'clock too, maybe, there were a lot of bands placed. So you can see with the neosquamous epithelium where the previous ligations were placed. And the columns went up pretty far, almost mid-esophagus. And so here's like one column that was banded, obviously. But fortunately, I don't know if you guys agree, that I don't see really any prominent active varices, at least proximal to this area where there seems to be a large patch of neosquamous epithelium.
Some data show that post-procedural pain is less after cryo. And if we would do here RFA about such a long distance, we should consider significant pain after this may be an advantage of cryo.
So we're going to start here. So I'm going to step on the pedal, and you're going to see it now move forward towards me on the posterior wall. This is a 3 centimeter 180 ablation, which I know he'll need another stack because of the length of his Barrett's. And so it's going to stop automatically when it delivers. There you go. So now we're going to, it goes back to the kind of base position. I'm going to deflate the balloon and come back about a couple centimeters.
This could be a real game changer, and they're working on a 360-degree balloon as well, which will then rival the RFA 360.
Yeah, so I turned on the NBI just because I need to plant the next, you see that border between the ice patch well? So I'm going to plant the next stack just right at that border. So now I'm going to plant it with a little bit of minimal overlap to get the next stack of 3. Yeah, once we get the 360 balloon, we're ready for a randomized trial, Horst.
Yeah.
All right, so this is the second stack. And then this is a travel speed of the diffuser of 1 millimeter per second.
There's a risk of stricture formation with doing any kind of ablation therapy. So if you overlap, there potentially could be some additional stricturing that can occur.
Yeah.
That can occur with any ablation treatment that we use.
Yeah, plus we know he's going to come back with this long segment for at least another session, for sure. So I'm going to turn off the NBI and show you the ice wedge now. There's a little bit more proximal here.
But it's an excellent demonstration. You show nicely how to apply and how to readjust the balloon. So we learn a lot from this procedure.